Hello guys, this is Krishna. So in this video you are going to see basic important questions from the skeletal system. So the first question is kneecap is also known as. So what is the name of the kneecap? Options are femur, fibula, patella, tibia. So the right one is the patella. So patella is the bone. Here you can see the picture. This is called triangular bone, the small bone. It is called a kneecap, and it is also known as the sesamoid bone. Sesamoid bone means this bone is made with the formation of tendons. Okay, so the next question is total number of vertebral column. So how many bones are present in the vertebral column? 25, 33, 29, and 40. The right one is a 33. So 33 bones are present in the total vertebral column. So here you can see the cervical, thoracic, lumbar and sacral coccyx. The total number of vertebral column bones are 33 bones. The next one is number of floating ribs. So in our rib cage, there we have the 12 pairs of rib bones are present. So among those, the two bones are the two pairs. Okay, the number of floating ribs are two pairs. So two pairs of bones are present here. Those are called floating ribs. So other options are wrong. The two pairs are present in our rib cage. Those are floating ribs. The next question is total number of bones in our human body. So here you can see the dancing skeleton. So how many bones are present in our body? Options are 306, 206, 209, 300. The right number is a 206. So 206 bones are present in adult skeleton, and in the case of newborn the total number of bones are 300. So as growing the bones are fused into together, and final one is the 206. So the next one is contraction of abdominal muscles. So contractions of abdominal muscles. It means what is the purpose of contraction of abdominal muscles? Options are for normal respiration, forced expiration, normal inspiration, forced inspiration. The right one is a forced expiration. So forced expiration is nothing but the abdominal muscles which are present in our body. So those muscles are helpful and responsible for the expression of by forcefully. For example, during our vomiting, these abdominal muscles only responsible for the purpose of vomiting. Okay, and also even for the forceful expression, that is nothing but to exhale the air from the lungs. So by the pressure of the abdominal muscles it will give the force on diaphragm. So diaphragm will force on the lungs to expel the air in the lungs. The next one is site of growth in length of bone. So in the bone, total bone, so where we can see the development and growth of the bone, we can see options are diaphysis, bone marrow, epiphyseal plate and periosteum. The right one is epiphyseal phase. So epiphyseal phase you can see here. Okay. So this is called epiphyseal phase. So growth of the bone is occurring here only. Only the at the site of epiphyseal phase. But remaining part will be same. But in the case of fractures, other part also can be formation of new bone cells we can see at the site of fracture. But normal growth of the bone we can see at the epiphyseal plate. The next one is the long term effect of a prolonged diet for the containing too little calcium would be included. So when the person is taking less calcium food for a long period, so what will happen? Options are increased calcitonin secretion and increased thyroid hormone secretion, decreased bone thickness. Option D is the acromegaly. So the right one is decreased bone thickness. Why? Because when the person is taking very less amount of calcium, what will happen? The bone deformity and bone thickness and density will be reduced. The next one is the clinical manifestation of fractures include. So when the person got the fracture, what are the clinical features we can see? Option A, fever, heaviness and weakness, edema, pallor and ecchymosis, pain, pallor, paresthesia, pain, coolness, loss of pulses. So the right option is option C. The person will have the fracture side will have the pain and pallor and paresthesia. So paresthesia is nothing but, so it is just like a kind of heaviness and a tingling sensation and a pricking type of pain. Something is a difficulty to explain the type of pain that is called paresthesia. So the person will have the pain, pallor and paresthesia. We can say at the site of fracture. So the next one is types of fractures. Options are simple fracture, green stick fracture, compound fracture, all of the above. So the right one is a all of the above. So here you can see the types of fracture here. So in this we have the total 5 types. First one is the green stick fracture is nothing but some part of the bone will be damaged, and a transverse fracture is nothing but the damage will be complete. So there is a complete gap we can see in the transverse fracture. So in the case of comminuted fracture, here you can see the a bone particles are present. So the bones are going to damage into the small particle that is called comminuted, and a spiral is nothing but it is like a rotation type of fracture, and a compound fracture is a large fracture, and here you can see the open wound, the bone has came from the out of the skin, that is called open fracture. So compound fracture is also nothing but open fracture. So these are the types of fractures. So the next question is, which of the following is a fracture in which bone is shattered into numerous fragments? So I already said just a previous question. So when the bone is formed into the damaged into the small fragments, that is called. Options are displaced fracture, comminuted fracture, evolution fracture, spiral fracture. So what is the correct answer? Please put in the comment box. That is option B, comminuted fracture. So comminuted fracture is nothing but the fragments which are the formation of fragments in the fracture site. Okay. The next question is fracture of distal end of the radius bone. So when the bone of the when the radius bone at the site of distal end, when it is fractured, what we call? Options are Hugh fracture, Montague fracture, Galazzi fracture, and Cooley's fracture. The right one is a Cooley's fracture. This question is very important, ma. And this Cooley's fracture is nothing but the radius bone at the distal end of the radius bone fracture. It is called Cooley's fracture. This kind of fracture we can see mainly in the children's. So the next one is what is acetabulum? Options are tailbone, socket of pelvis, head of femur, sacropelvic joint. The right one is a socket of pelvis. So here you can see the pelvis. Okay, one part of the pelvis, and here you can see the socket. Socket is nothing but it is like a bowl. So this is called acetabulum. So here the joint is the head of the femur. Okay, so this is the head of the femur. This is a femur bone, and this is a ball. So this ball will be joined here. So this is called hip joint. The next one is a first bone of vertebral column. So what is the name of first bone? Options are atlas, axis, clavicle, hyoid. The right one is atlas. So the first bone of the vertebral column is a atlas, and the second one is the axis. So the next one is ear ossicles are made with. So ear ossicles are nothing but the smallest bone in our body. Those are malleus, incus, and stapes. So among these three bones, the stapes is the very smallest bone in our body. So these bones are made with it. So what type of tissue we can see, what type of cartilage we can see in these ossicles? Options are hyaline cartilage, fibrocartilage, elastic cartilage, none of the above. The right one is the elastic cartilage. So in the ear bones, these bones are made with the elastic cartilage. The next one is ossification of bone start with. So in the embryonic period, when the ossification of the bone will be start, and which bone it is. So from which bone the ossification will be start. Options are clavicle, femur, cranium, and pelvis. The right one is the clavicle. So the clavicle is the first bone in the embryonic stage. The ossification will be start with the clavicle. So clavicle is also known as collar bone. The next one is elderly women prone to get fractures because of. So in the old age, the people are a higher risk for the fractures. So it is mainly in the case of women. Why? Because options are increased bone density, decreased estrogen production, increased calcium absorption, sedentary lifestyle. The right cause is the decreased estrogen production. So it is mainly in the case of women. Okay, so in the case of women, the production of estrogen in the body, it leads to the risk for the fractures. The next one is during bone healing process, the remodeling takes place from. So in which day the bone remodeling will be taking place? Options are 7 days, 14 days, 18 days, 29 days. So if you know the answer, please put the correct answer in the comment section. So the right one is the 18 days. So option C is the right. So from the 18th day, the bone remodeling will be taking place. The next one is Spica cast is used for. So in the picture you can see this is a cast. The child is carrying a cast. So what is the purpose of having this type of cast? Options are arm fracture, or the leg fracture, foot fracture, or the hip fracture. So you can easily answer for this question, that is hip. Okay, so when there is a deformity or any congenital deformities, when the children are having, so spica cast can be applied. Okay, here you can see the spica cast. So it is mainly for the hip. The next one is What is average weight should be used for the traction on extremity? So for the patient, we will give the traction and also we will hang some of the weight. So what is the normal weight to hang for the traction? Options are 1.2 to 1.5 kgs, option B 2 to 3.5 kg, option C 4 to 5 kgs, option D 5 to 5.5 kgs. The right weight is the 2 to 3.5 kgs. So this is the normal weight for the traction. The next question is gout diseases. So what is the meaning of gout and how it is occurring in the human? Options are option A pyrimidine metabolism. Is it due to the pyrimidine metabolism? Otherwise purine metabolism or amino acid transport deficit and mismatch repair of DNA. So the right cause is the purine metabolism. So after the purine metabolism, the excessive formation of urea, okay, so it leads to the gout disease. So gout disease caused by the formation of uric crystals at the site of joints, that is called gout. The next one is Heberden nodes are seen in. Heberden nodes are seen in. Options are rheumatoid arthritis, osteoarthritis, spondylolysis, and tendinitis. The right one is osteoarthritis. So, Heberden nodes are present in the case of osteoarthritis. Osteoarthritis is nothing but inflammation of the joints. The next one is, this is the last question, windspread deformity seen in. So here you can see the windspread deformity. This is called windspread deformity. So in which condition we can see? Options are rickets, scurvy, spondylitis, and achondroplasia. The right one is the rickets. So rickets is the cause for the windspread deformity. So these rickets are due to the deficiency of vitamin D. So due to the vitamin D deficiency, the children can risk for the rickets disease.